This patient was referred to me regarding this hot tooth, number 19, older crown. And this tooth, a hot tooth, so you can Google the definition of a hot tooth. But anyways, a hot tooth is a tooth that the patient is in a lot of pain, and getting the tooth anesthetized with local anesthetic is very difficult, very challenging. Also, I want you to pay attention to this area right here and here. When you have a hot tooth, when you have irreversible pulpitis so severely, so extensively, sometimes what happens is that the inflammation of the pulp kind of leaks to the outside, causes inflammation within the periodontal ligament, giving you the impression of periapical radiolucencies associated with the tooth. So you think that you're dealing with a necrotic tooth because you need a necrotic tooth to have periapical radiolucencies, right? So, but no, the tooth is not necrotic. It's just the inflammation within the periodontal ligament giving you the impression that perhaps there's periapical radiolucency. All right, so these are not periapical radiolucency. These are inflammations within the periodontal ligament that give you the impression of there's a periapical radiolucency, but the canals were definitely hyperemic. So today went through the porcelain crown and did the root canal for this patient. And take a look here. And here's the post-op. As you can see, everything went beautifully. 4 canal systems. The distals, as I instrumented the canals, they joined coronally and then later on down the canals apically. But everything went beautifully, as you can see. And we went ahead and temporized the tooth and referred the patient back to her dentist for the permanent restoration. Remember, I presented tooth number 20 here with this patient. I had done this root canal many years ago. The tooth had a periapical radiolucency. I'd done the root canal in one appointment through the crown. She still had the same crown that I had gone through many years ago to do the root canal on tooth number 20. The endo axis was restored with composite at her dentist's office, but I presented this number 20. But as you can see, tooth number 19, everything went beautifully. And she can maintain this crown, just like she kept the crown of tooth number 20 when I went through it and did the root canal many years ago. Tooth number 19, porcelain crown, is fine. I just went through it, didn't crack or anything. So placed sterile sponge and cavit, and she'll go back to her dentist, and her dentist will remove the cavit and sponge and clean the pulp chamber, etch it, bond it, and build it up with composite, and she should be okay. No need for a new crown unless her dentist recommends it. But she was worried about the crown too. She's like, am I gonna need a new crown? I said, I don't know. I'm gonna do my best, but I'm gonna have to drill through it. And I gave her the good news that her crown is fine, and she was very happy. All right, excellent, very good. 20 minutes.